This presentation will discuss herbal medicine and its use within the geriatric population. In some cases, herbal medicine is used to treat diseases or maintain health along with or in replacement of the use of medications. They are mainly derived from plants and are intended for internal use as supplements and also as external use, both effective when used in a safe manner. They can be used internally in the form of pills, powder, and brewed as tea. Externally, they are used in methods such as topical administration and added to bath water. The FDA considers herbal medicine as food rather than drugs, therefore, extensive studies are not conducted as they would be for drugs. The use of herbal medicine to treat diseases and maintain optimal health dates back around 3,000 years in most parts of the world. Specifically, over the past 100 years, herbal medicine has revolutionized healthcare to promote optimal health for many patients.
Herbal medicine in the geriatric population. Herbal medicine appeals to older adults due to its lower price, availability, and accessibility. Older adults with many comorbidities tend to use herbal medicine due to the price and accessibility of prescription drugs. Many older adults enjoy herbal medicine as a complement to their prescription drugs. Older adults may use herbal medicine to relieve symptoms of chronic issues and pain. Uses of herbal medicine. Herbal medicine is only recommended to be used as a supplement. Herbal medicine can be used in assistance with drugs when treating ailments. Herbal medicine is often used for pain relief, to improve mood, boost the immune system, and to reduce symptoms of chronic issues. Using herbal medicine in concurrence with prescription drugs should be discussed with your doctor as there could be adverse side effects. It is important to note that herbal medicine is not a replacement for prescription medicine.
An important point to note in patient teaching for herbal medications in the geriatric population is specifically the drug and herbal interactions. Just to name a few, if a patient is on anticoagulants, NSAIDs, or antiplatelet agents, medications in the herbal class such as garlic, ginkgo, St. John's wort, ginseng, saw palmetto, ginger, and cranberry can counteract those medications. Patients that are typically on diuretics should not take ginkgo, ginseng, kava, or cranberry as they can interact as well. And any patients on chemotherapy should avoid St. John's wort, ginseng, kava, and cranberry again. Another important teaching point for the geriatric population regarding herbal supplements is their potential side effects. For example, if they are on echinacea, which is typically used for immunity, their symptoms could be fatigue, dizziness, headache, and they may possibly have GI symptoms. For garlic, we want to look for nausea, a burning sensation in mouth, throat, and stomach, halitosis, and body odor. And for ginseng, we want to look for anorexia, rash, changes in blood pressure, and even headache. When conducting patient teaching for the geriatric population regarding herbal supplements, it is always important to note that older individuals may have a greater incidence of having multiple medical conditions and be taking multiple medications at the same time. We want to advise them to consult with their primary care doctor to make sure they are avoiding any interactions or contraindications that were listed on the previous slides. We want to also advise them that just because a supplement is listed as natural does not always mean that it is safe or free of adverse effects. When it comes to their health, we want to advise them to ask questions if they are ever in doubt and to make sure they are consulting with their primary care doctor. Regarding risks of misuse of herbal supplements in the geriatric population, there is a lower risk of misuse than standard drugs, but the risk is never zero. There is no specific risk of misuse regarding herbal supplements in its entirety. So, just to name a few, and the risk of taking too much, aloe can create hepatotoxicity. Turmeric and clove can increase the risk of bleeding and even counteract warfarin therapy. Eucalyptus may cause ataxia. Ginseng can cause hypoglycemic events. Ginger can cause heartburn and even stomach distress. And nutmeg, when taken in surplus amounts can cause hallucinations, which can also be unrecognized drug abuse.
People have been using herbal medicine due to its many advantages. It can treat minor conditions such as rashes or burns without having to go see a specialist. So, in many cultures, herbal medicines have been used for generations. People believe that natural products are safer and healthier because these therapies are free of chemicals. Individuals choose herbal medicines because it is easier to obtain than pharmaceutical drugs and there is no prescription needed. Herbal medicines can be found in everyday foods such as ginger, garlic, and rhubarb. In addition to that, people can buy herbal medicines at a very low cost. According to an article, people could save up to 63% of the cost in healthcare annually with herbal medicine. Although herbal medicines are considered natural, it does not necessarily mean that it is better than conventional drugs. Herbal medicines also come with many disadvantages. Some of the potential dangers include the risk of excessive and chronic use since many people often self medicate. There is no dosage or warning indicated with this type of medications, which is why it is not strictly regulated. Depending on the patient's medical history, the use of herbal medicines could also be contraindicated with the patient's medications. One example is taking ginger while a person is also taking warfarin. The combination of the two puts a patient at risk for excessive bleeding. Another example is the herb rhubarb. The stem is basically edible and the roots are used as a laxative, but the leaves are actually poisonous. So, if people are not aware of its overall use, it can cause more harm than good to a person's well being. In addition to that, there are also reports of allergic reactions from certain herbs that could be detrimental to patients. Though some people claim that herbal supplements are effective, the usage of it is subjective and varies from one person to another. It might be effective for one individual, but not for others. Another disadvantage is that the use of herbal medicine takes longer to work compared to conventional medication. If a patient takes a drug that needs to take effect fast, herbal medicine might not be the right one to use. When it comes to evidence based practice, so research takes years of study. Researchers do thorough clinical trials of medications to prove its effectiveness and safety. There's not much research with regards to herbal medicines, risk and benefits. For this reason, the government does not approve the use and do not advise the public to use it without consulting a healthcare professional first.
The way to incorporate herbal medication into treatment is first assuring the efficacy and quality of any herbal agent, along with any medication interactions, setting correct dosage limits and following the prescribed dosage only, accurately diagnosing and choosing the correct complementary herb, and warning about any side effects, whether that be from medication interactions or from the herb itself. Evaluation of use of herbal medication is evaluating outcomes of the treatment, so whether there is improvement on the primary diagnosis or no improvement. Evaluation of patient responses, so lack of adverse effects or side effects, no cross reactions with any other medications, and the herbal medication is used safely and the correct dosage is understood and followed during treatment.